Welcome to the Positive Persistence Podcast, where ordinary people inspire your extraordinary success. Hey, what's up, family? Have you ever been told that this is as good as it's going to get and felt in your gut that you couldn't be the end of your story? Now, our guest today was told she would never run again after multiple knee surgeries as a teenager, and then she went on to run a marathon. Sound familiar a little bit? Well, today we are joined by someone who, out of her own journey, through pain, setbacks, and the limits of traditional options, has built a chiropractic practice focused on conservative, whole body healing that helps everyone from athletes to grandparents keep moving and live a full life. Dr. Tiffany Bozovich, welcome to the show.
Thank you for having me.
Yeah. All right. So we had a conversation in your office a couple of weeks ago, and I have been itching to have this conversation with you because we talked about a couple of things that I thought were really relevant for our listeners and viewers to hear and talk about. But before we dive into any of that, I want to ask you this. Okay. Now, doing a little research, I found that chiropractic care was once widely denounced by the American Medical Association because it recognizes the flow of energy through the nervous system that is pretty, I guess, influential, right, in controlling our physiology and health. And it was seen as an energy-based modality and not a proven science. And I wondered, what is your take on that? What do you have to say for that?
I think like any professions that you go into, there's going to be different types. So same with chiropractors. There are a lot of different chiropractors out there. There are a lot of chiropractors that are more philosophical based, that deal a little bit more with the nervous system being more of what they like to treat. I actually went to National University of Health Sciences in Lombard outside of Chicago. And the reason I chose that school is because it was very science-based. Their curriculum was very heavily rooted in, if it wasn't proven, they weren't going to teach it to us. So we got very little philosophy and a lot of science-based. So we got a lot of rehab, a lot of physical therapy. We just were trained as primary care physicians, which in the state of Illinois, chiropractors are actually considered primary care physicians. So we were trained that way. So when I came out of school, and I didn't have a background in chiropractors prior to going to the school, I just got sidetracked and got taken into chiropractic school by meeting a chiropractor and falling in love with the profession. So I didn't know a lot about the philosophy part of it. So when I started to meet more chiropractors outside of school, that's actually when I learned about it. So it wasn't a thing for me. I've just always thought that it was science-based, like what we did has been proven, and that we can help people through helping not only their nervous system, but also through rehab and physical therapy type modalities, along with the chiropractic manipulations that we do just to help remove restrictions in the joints.
What you just alluded to kind of covers your holistic approach to chiropractic care through your practice, which we'll get into in a little bit. I want to get into your story. As we alluded to in the intro, you were told after knee surgery that you would never run again. And then 10 years later, not only do you run like your first mile, but you went on to run a marathon. And I was wondering if you could walk us through, because you have a lot of experience, obviously, with individuals coming back from a setback, coming back from an injury, coming back from something that ails them. What was the mental journey between those 2 points of you're never going to run again and you finishing a marathon?
Well, how much time do you have?
Well, here's a follow-up question. Let's start here. What was happening in your head when everyone official, all the white coats, if you will, said it wasn't possible?
I had 4 knee surgeries, the first one being in high school, the second and third being my freshman year in college, which ended my basketball career. And then my fourth being my senior year in college, where I was finally told, you can't run. You're never going to run again. They had to do complete reconstruction on one of my knees. At the time, running wasn't even enjoyable for me. So I don't think I even processed it as an issue then. Being told I couldn't play basketball was more of an issue for me. So freshman year, that was crushing. That was a whole other grief that I had to go through. Honestly, being told I couldn't run at the time it was said to me, I didn't even think about it. I just moved on and, did what I could do. What can I do? What am I allowed to do? So
Right.
they gave me the list of things I could do. And that's what I did for years until I got the itch to run.
You said something very interesting right then, and that is you had to deal with that grief, right? Because up until that point, basketball was a huge part of your identity. Being an athlete was a huge part of your identity. And I think that for a lot of people, when something happens in their life and they are now unable to do something, or they have to change the way they were doing something, especially when it's not by their own decision, right? Their identity has to change. And that really messes with people. So what were some of the coping mechanisms for you? If you can kind of reach back into history and go back at a time, like, how did you deal with that? Like, how did you deal with that quote unquote grief of this is what I do, this is who I am, but now I'm being told I can't do this anymore?
So as a immature 19-year-old at the time, being told I could no longer play basketball, I went back to school and I was there to play basketball. Obviously, the coach knew that I wasn't allowed to play anymore. So I signed up for rugby. And when I
Yeah.
when I went back for my follow-up appointment with the surgeon, he asked me, have you joined any clubs? How are you handling this? I said, oh yeah, I joined rugby. It's amazing. He whipped his clipboard across the room. I was the worst patient on the planet. He told me, I told you couldn't play basketball. Why in the world did you think that rugby would be a good alternative?
Yeah.
And in my brain, 19, all I heard was you can't play basketball. I couldn't play sports that were running or jumping or being hit by players. So then he told me, I want you to join crew. So I became a good patient and I rode. And that actually was, I'd never rode before. It was amazing. I think it helped me get that energy out that I needed to, that competitiveness, having a team, joining something, I think really did help. The rugby team was great. It was fun. I've never met better drinkers in my life, but I think crew was a little bit easier on my knees. So I think it was probably a better choice, and the surgeon knew what he was talking about with that. I would say for people that have to go through that, when you're told you can't do something that you love, finding something that you can do that's as close as to what you can't do anymore, no matter what that is just looking for the similarity and something that feeds your soul in a way that activity used to, or whatever it is.
That's so important. Something that you can find, I guess, for lack of a better word, substitute.
Yes.
For that. You used a very important 3-letter word there, can. And you have said this a couple times already in this conversation, what I can do.
Yes.
So, and I think this is super important because when we are handed that, I guess, that black and white decision by the medical system that you are not going to be able to do this, or you have this certain scenario or situation or diagnosis, how can people better advocate for themselves without feeling like they're going against their doctor? What a lot of us hear is what we can't do.
Right.
But we rarely ask, like, well, what can I do?
Yeah.
So it's interesting, like, in you being in that position on both sides now of the spectrum, like how can people advocate for themselves?
I do think that that's probably one of the most important questions to ask is, what can I do? What am I allowed to do? I work with a lot of patients who I do refer to orthopedic surgeons when I say, this is out of my wheelhouse. You need to speak to a surgeon. We're looking at your MRI. This is not what I do. I don't fix things like this. So talk to the orthopedic surgeon. If you don't like what they have to say, or your gut is telling you this can't be right, get a second opinion, get a third opinion, ask questions, talk to you have Google, you have ChatGPT. I never love the Dr. Googles that come into my office, but at the same time, there's some of the people that know how to advocate for themselves because they do the research, they look into it. They're not just believing what one person says to them, because I don't know all the answers when patients come to me. There are times where I say, like, let me look into it and I'll get back to you. And I will. I might call them later that day. I might talk to them the following week, but I don't know all the answers for my patients. And the orthopedic surgeon, they're not gods. They don't know everything. So always question, always ask what you can do, what your options are, what all the options are. I think it's good to ask questions and just know as much as you can before you make a big decision.
What you just said is so important, not only in trying to come back from an injury or an illness. But if you can extrapolate that out into just life in general, when you are running up against an obstacle or a challenge or some sort of adversity, that you don't just take it for face value and say, well, I guess I'm done. That sucks. That's over. That's the end of my story. You have to explore all the options of how can I get over this hump? How can I climb this mountain? How can I continue to persist so I can achieve the goals that I want to achieve and go through this problem or this issue? I guess this kind of alludes to like turning frustration into purpose, like when that frustration actually turned into purpose for you, where it stopped being like, this is just my bad experience, and became, I'm going to build a different path and actually figure this out and eventually help other people do the same.
After I had my daughter, I'd been in practice for a few years at this point, 8 or 9 years. And about 80% of my patients during that first 10 years of practice were actually runners. I had a really nice practice out in Cherville. I worked closely with Fleet Feet out there with their runners, and that was kind of how I built my practice. And shortly after I had my daughter, probably a year or so after, you have the little extra 10, 20 pounds that you want to lose. And I was treating so many runners, and they all had this joy about running, and they were just my happiest patients. And I was like, you know what? I'm just going to try it. I am helping all of these people be able to run. Why can't I? Just because one surgeon told me I couldn't do it. And so I went home, I put on a pair of tennis shoes that were not running shoes, and I ran a quarter of a mile just to see if I could, and I could. So then I knew a running coach at Fleet Feet. I asked her to write me an easy couch to 5K program, and she did, and I followed it to a T. And I'm one of those people where if you give me a schedule or a plan, I will follow it. I am type A when it comes to that. So I followed it exactly as she said. The 5K turned into a 10K. The 10K turned into a half marathon. And I was happy doing half marathons. Being told I couldn't play basketball was a big moment in my life. But a couple years after my daughter was born, being told that I could never have children again, that hit me harder than probably anything ever has in my life.
Yeah.
We're actively trying to have another baby. So I just kept running, and I decided, you know what? They said I couldn't run. I'm going to run a marathon because my body is failing me again. They're telling me it can't do something that I should be able to do. And so I'm just going to go run a marathon. And it turned into my therapy, I think, the running. I've lived in Chesterton my whole life. The dunes have always been kind of my church.
Yeah.
And there was a Sunday running group that would run long distance out there. There were a bunch of ultra marathoners, and I just joined them. And it was probably my therapy for getting through that grief of not being able to ever have a baby again. And that's probably what drove me to do the marathon.
That's awesome, man. Thank you for sharing that. I think that's so important for, again, just life in general, to find something that can help you get through a trying time.
Yeah.
Something that that can divert your attention, that you can pour yourself into to help you get over that grief and be able to move forward and move on. So obviously now you're a chiropractor, you're focused on healthy aging, conservative care, and even non-invasive pelvic floor therapy, which I had the opportunity to learn a little bit about a couple weeks ago.
Yes.
Now, for someone in pain who just wants a quick fix, how do you help them see the long game? Like why strengthening, alignment, and lifestyle might be more powerful than another surgery or just medication?
The way that I approach treatment in my office, I think showing people more so than talking to them. What I like to do is actually show people, look, you are having this issue. Watch what can happen if we just get muscles firing the way they're supposed to. So very first visit, I'll muscle test, find muscles that are not firing, give them a very easy exercise to show them that they can get these muscles firing again. And if we can get those muscles firing again long term, it helps alleviate a lot of the stress, inflammation, damage that's being done to the joints where those muscles attach. So I think a lot of times when people come to see me, if they've been referred by people they already know, like we're in this for the long game, getting you to feel healthy as long as possible and do this, what your body can do. I can show you how to do it, but you're the one who's gonna have to put the work in. But for the people who just want to come in and get their neck cracked because they woke up with a stiff neck and they just want it fixed like that, I don't know that I necessarily try to convince people. I like to just kind of show them and let them kind of see what's going on in my office. I don't want to badger people and say, like, this is the best way. I think people are either going to see it or they're not. And once they're ready, once something happens or they can't do something that they want to be able to do, then they start to come around.
Isn't that a misnomer about chiropractors, that you go in and you just get cracked and that's what they do? They say, crack your bones and send you on your way.
Yes, I think a lot of times what people say to me that don't like chiropractors is, well, I don't want to have to go for the rest of my life. You don't have to. I mean, our office, we encourage maintenance, but we don't force you to. And I have probably 50-50 split of people that like to come in once in a while to get their muscles checked and get adjusted, get a massage. And then I have people that just come to me when they're in pain and want me to run through muscle testing and get things firing again. Depending on what kind of chiropractor you're seeing and what kind of treatment's being done, it can go both ways.
Okay, that makes sense. Now, you work a lot with healthy aging, and I'm curious, like, what are some of the most, we'll call them, damaging beliefs you hear from people about getting older?
I would say people focus on what they can't do. They dwell on I used to be able to do this and now I can't. What I like to reinforce is, but you can do this. Yes, you may not be able to run for an hour like you used to be able to, but are you able to walk for an hour? Are you able to go hiking for an hour? Are you able to walk for 5 minutes, run for 5 minutes? You have to be able to, I guess, pivot would be a good word when things get in your way, whether that's pain or life or anything in general, and be able to figure something out. I think the reason I always talk about, what can you do is there is a quote that is in my office. My grandfather was the first football coach at the Chesterton High School. And I was reading an old newspaper article from, I think, the 90s when he was still the coach, where they interviewed him. And the quote said, "Success will come if you stick it out. Sooner and later in life, you get a chance to prove yourself." It was him talking about not quitting, just keep going. And I was 12 or 14 years old when I read it. And I drew a picture and I wrote that quote in it. And to this day, that quote sits in my office framed. I mean, I've carried it with me to college, to chiropractic school, to every office I've ever been in. And I think that's what kind of drives my thought process for myself and for my patients. Just, you have to stick it out. You can't think of everything that went wrong. You have to think about what can go right and which direction you want your life to go.
I love that. Yes, I wholeheartedly agree with you on that. And I'm just curious, for the individuals who don't get that or don't understand it, who continue to have those damaging beliefs or disbelief, in your experience, how does that actually shape their pain, their posture, their function over time by not thinking positively?
It exacerbates everything. The people who are in the most chronic pain that I typically see, I mean, there's usually an emotional component to it. And a lot of them will agree. I mean, a lot of my patients that come in, they'll say, it's been a really rough year and my body is feeling it. They know, like, people know, even if they don't know when they're saying it, they know, when things get tough and you're stressed and, you're just down in the dumps, things just don't feel as good. When the sun comes out and, we get that little bit of vitamin D and the body starts to feel a little bit more nourished and you're up moving around, you just feel better. But I do notice, the people that are in the most pain are usually the ones that like to talk about how much pain they're in and that it's not going to get better. And how long is this going to be for? How long am I going to have to deal with this? And it's hard to shift their mind. And it's just me constantly saying, you were able to do this, or you got out, you did a 5-minute walk. Why don't you try for 10 tomorrow? Like, let's get out there. I don't want to say too much about specific patients because of HIPAA and all that, but there's definitely a generalization, I think, that I see with my patients that are in more pain and more chronic pain.
If you're listening to this, there's a good chance you're what I call a sidelined achiever. You know you're capable of more, but right now you feel stuck, setback, or like life has benched you. Maybe it was an injury, a diagnosis, a layoff, a failed business, or maybe even a broken relationship. Something knocked you off your path and left you wondering, what now? How do I even start moving forward again? You're fed up feeling this way, but you don't have a clear roadmap out. Here's what I want you to hear. You are not broken. You are not done. You are not disqualified. You're just sidelined. And sidelines are where legendary comebacks are built. And that's exactly why I created the Rinse Method. It's a framework I used to go from being told I'd never run again to crossing a marathon finish line. Rinse is a simple, repeatable process that helps you build real daily resilience, turn adversity into momentum, tap into the strength you already have, and hold yourself capable of doing what once felt impossible. If you're tired of being stuck and you're ready to create your comeback, not someday, but starting now, head over to watchmemindset.com. Yeah, I think there's a direct correlation with mindset. You know, in my own experience being in physical therapy and in chiropractic offices and seeing the people that were there and complaining and not really wanting to do the work and just showing up for their appointment and letting the chiropractor or the physical therapist manipulate their body and have them do the things that they need to do then in that moment. And then after that, they didn't do any extra work on their own. They didn't do anything to improve their situation other than come to that appointment. Those people tended to heal, get better a lot slower than the other ones that are like, okay, here I am. Let's get to work. Let's go, doc. What else can I do? What else should I be doing to help improve my situation? And also having a good temperament about this isn't necessarily a permanent problem that's going to last for the rest of my life. But the individuals who have that limited belief, I feel like they're making a permanent decision over what could be a temporary issue. And it's a cycle that they have a hard time getting out of. So all that to be said, everybody, when you're listening and watching this, mindset is everything. Okay.
Yes.
All right. Let's come back to a question I have for you about the pelvic floor therapy. Because again, this was like new to me. I've heard of, pelvic floor exercises that you would think would be just for women, but who knew it would be for men too, right? And it's kind of, I guess it's still maybe a little taboo to talk about. What kind of issues do you see, especially with women and aging adults, and then also with men who need this pelvic floor therapy?
So I think the biggest complaint that women have is leakage. A lot of times after having babies or even just with age, not being able to hold in urine while laughing, coughing, sneezing, it becomes an issue. And, women don't talk about it. And I learned about this non-invasive pelvic floor chair 5 years ago, or I guess 6 years ago now, right before COVID hit. And I was obsessed. I was like, you know what? There's a lot of women that don't want to do invasive pelvic floor because it is invasive. And there's women who are not getting treatment because they don't want to go through it. I found out about the chair and I loved it and I wanted to get it. And then COVID hit and I put on the brakes and said, nope, not yet. So I finally did it. And the number of women who are now talking to me, to each other about these issues is phenomenal. I wish more women would just talk to their doctors about it, because I didn't realize how many women were going through it until I started talking about it. I treat the pelvis in my office. It's on my intake form. Do you have leakage? And no one, wants to mark yes. No one wants to talk about it. And it's amazing to me that life-changing technology that this is and the people's lives it has touched so far. I mean, I had a woman come in and hug me because she could sneeze and cough without crossing her legs. You don't think about that stuff, like that people
Right.
are going through this, like being out in public and feeling like you're going to sneeze and have to run to the bathroom and possibly go home and change your clothes. And, to be able to treat that is awesome. Like I absolutely love my pelvic floor patients so much.
That scenario that you just gave is real, right?
Yes.
That's real for a lot of women that may have that instance come up.
Mm-hmm.
And I think it's not hard to imagine why that would be after having babies. But for men, what are some of the issue that you're treating for men?
So for men, the number one cause, this isn't something I've read, but what I see is a lot of men, especially after having their prostates removed, there's a lot of weakness in the pelvic floor afterwards. So there's erectile dysfunction, there's leakage, there's difficulty. So strengthening the pelvic floor can help all of that. And I don't know that, men talk to their doctors because I think guys are even worse than women when it comes to talking to those things.
Do men even go to the doctor? I mean, let's start with that. I mean, that's a whole nother story.
I don't know. When I went through the training on the chair, that's when we learned about these things.
Mm-hmm.
I have not treated men in my office yet. The chair is still pretty new, and I have not necessarily marketed towards that. I don't know how many male patients feel comfortable coming to a female doctor, but I mean, I will talk about anything. So my favorite patients are the patients that come in and they're like, Doc, I just pissed my pants and I need help. Like, those are my people. Like, just come in and tell me what's going on. Don't beat around the bush. Just give me it. Like, give me all of your symptoms so we can fix you. Never be ashamed of what's going on. You can't help it. Like, let's get you fixed. Let's help you so that you can enjoy your life. I mean, if you don't ask, you're just going to be living with it. So I love the people that are just like giving it all to me so that I can help them.
If nobody tells you what's going on, then you can't help them.
You have no idea.
Right. So it's just like, get over it.
Yep.
Get over the uncomfortableness of telling somebody about your issue so they can actually help you and potentially change your life.
Yes, exactly.
If you could rewrite, the cultural default message about pain and injury from you're broken, you're hurt, slow down, you won't be able to accept it, to something more hopeful, what would that new story sound like?
I think I view pain a lot differently than other people. So I think if we could rewrite the story about pain and what it means, I think that would help create more hope for people. Pain is not necessarily the end. It does not mean you have to stop. Pain is your body's way of telling you, or your brain's way of telling you, that you need to pay attention to something. Receptors telling your brain that there's something going on in the body. I think people are scared of pain, and they shouldn't be. It forces you to pay attention to that area or that activity so that you can figure out, or let someone who knows how to figure out how to help you to either get through that or to change what you're doing so that it doesn't hurt anymore. I think a lot of times people just automatically stop, like with the running. I run, my knee hurts, so I don't run. Well, what if we can figure out what it is about the running that's hurting your knee so that you can keep running? I think that's how I would rewrite it. It's not the end of the story. It is just means that you need to pay attention more. The body is amazing. The body can heal itself. You just have to give it the tools to do it.
Mic drop moment right there. Because I'm sitting here listening to you and I'm thinking like this is such a parallel just to problems and issues that we have in life. Like so many of us will have an issue and we'll stop. That's painful. And we know that the human body moves away from pain. It's uncomfortable. We don't want to deal with that, whether it's physical, whether it's emotional, but we just move away from it instead of finding a way to deal with it.
Mm-hmm.
Right. And if we can just change the way that we think about it, change the way we think about pain as it's just a message to say that, okay, maybe the way that we're doing things right now isn't the best way. We can find another way to continue moving forward, whether that is with goals in life, whether that is with physical just being able to move and being able to ambulate around pain free. But there are so many lessons to be learned from what you just said in terms of, the body is an amazing thing. The human being as a whole is an amazing thing. And we can find ways to overcome adversity so many different ways, but we have to, like you mentioned, put in the work.
Yeah.
Do it. Well, Tiffany, I want to thank you so much for joining us and dropping some of these knowledge bombs on us. But I want to also, give our listeners, viewers a chance to find out more about you and your practice. So where can they go find out more information about your practice?
We have a lovely website. It is Bozovich Wellness, Bozovich wellness.com. And you will find myself on there. And I have a lovely associate, Dr. Owen, who came on board last year. So we have 2 chiropractors. We also have a massage therapist, Megan. So you'll find information about all of us on there. You'll find information about the pelvic floor therapy on there, and then all things chiropractic.
So I highly recommend you guys check out Tiffany's practice. Dana and I had an opportunity to go over there. Very cool, awesome people there. And the list of services that they also make available are super cool. So check that out. And again, Tiffany, thank you so much for joining us. And I want to thank all of our listeners and viewers for joining us as well. And we'll end it like we always do. And that is, remember to stay positive, stay persistent, and know that mindset is everything. We'll see you next time.
Thank you for tuning in and being part of the Positive Persistence family. We're having a great time creating this content, and we truly hope it inspires you to embrace positivity and persistence in your own journey. If this podcast episode inspired you or entertained you, scroll down, hit those stars, and leave a comment or two. Your 5-star reviews and shares encourage us and help us grow the show. So until next time, stay positive, stay persistent, and remember, mindset is everything.